Good afternoon, and let me start with thanking our course partner, World Youth Heart Federation, that is WYHF India, established 3 years back, and we have our head office at Vadodara, Gujarat, and then my staff, Climate Research Solutions. So we have come up with this. Okay, let me share the brochure. Actually, that would be great if I am talking to you. Yeah. So, I welcome you all to this certificate course in electrocardiogram interpretations. That is another, ECG master's course. And we are, starting today, right? Today is our induction and introduction class. So definitely, after this course, you will be having the ability to read and interpret a 12-lead ECG. And as we all know, this is our part of routine for all the healthcare students, all the healthcare partners, all the healthcare stakeholders, like they're either from the medical side or they are from the technology side. So sometimes if they are dealing with the patients, they are dealing with the ECGs. They are looking at the ECGs, and then we all know that cardiovascular problems are one of the major NCDs in India, non communicable diseases in India. Which are affecting with the mortality, which are actually dealing with the high mortality in India. So to make you all aware and to make you all what we say, the master of ECG readings, we came up with this course, which is our ECG masters course. This is a 3 months course, and we'll be having 10 modules in this. Okay, 10 modules in this. And as I have promised you, we have all renowned cardiologists and electrophysiologists from top-notch Indian hospitals and institutions who will be taking your classes. So definitely there are 10 classes for all of you, and you will be getting 100% live query resolutions, 100% live classes. If you are missing in any case, definitely recordings will be provided. I think my voice is not matching my video. Okay, wait, I'll just start it again. Yeah, so if you are not getting into the live classes, definitely you will be getting the recordings after within 24 hours of the class, right? And we are going to cover these all parts, as you must have seen in the brochure: anatomy and physiology of the heart, whatever is required for ECG interpretations, like our circulation system and our conduction systems as well, and then basics of the electrocardiogram, how to report an ECG, and then chamber enlargement analysis by ECG, then AV blocks, and other blocks as well. We were discussing with Dr. Harnish Bhatia. He's our course director. So I was just discussing with him 2 hours back, and we were completing your schedule. So he told that we should come up with 2 additional classes. So I don't mind at all, guys, and we are coming up with 2 additional classes for all of you. Okay, previously this entire course was finishing in 9 classes, but right now we are coming up with 11 classes. So anything for you, that's not a problem from my side. And as you know that that it is very important for all of us, and I really am looking for your cooperation, that you all are coming for the live classes, you all are attending the live classes and learning from all the mentors, all the our people, our resource persons who are giving you the time, giving you their precious time, what they are spending with the patients, what they are spending in treating the patients in different hospitals, different setups. So they are coming up and they are taking your classes. So please be there and try to learn from them live. So before I go to schedules, and I invite Dr. Harnish Bhatia. So let me introduce Dr. Harnish Bhatia, our course director for ECG Masters course. So Dr. Harnish Bhatia is working as a consultant cardiologist at Metro Group of Hospitals right now in New Delhi. And Dr. Bhatia has completed his MBBS from Sri Basantrao Naik Government Medical College and Hospital, Maharashtra University of Health Science. And then he did MD from our own Kasturba Medical College in Internal Medicine, Manipal Academy of Higher Education, Manipal. And then he did his DM in cardiology from Savai Mansingh Medical College, Rajasthan University of Health Sciences. So Dr. Bhatia has also received the gold medal for his DM cardiology exam at Rajasthan University of Health Sciences. Recently, he received Indian Heart Journal CSI Thesis Award for his PG, and A.V. Gandhi Sky Award for Excellence in Cardiology. Dr. Bhatia has published more than 10 papers in national and international cardiology journals. Dr. Bhatia has been a part of various national and international conferences and received many travel grants. So you are going to get one of the best. I'm telling you, he's not only my friend, but he is one of the wonderful colleague, and he's one of the wonderful doctor, and with a great knowledge. You are going to get a lot of things. You're going to learn a lot of things from him, and he's very humble. If you have any questions, not only him but all of our mentors, they will be resolving your queries in session, live in classes. So with that, I'll just give you a glance on our schedule that I'll be sharing with you in the group as well. What we're going to do is so your module 1, that is induction class, that's introduction class today. Right, and then we will be starting with anatomy and physiology of your heart. So every Sunday, guys, there'll be every Sunday classes at 4 o'clock, 4 to 5:15 p.m. Every Sunday there'll be class. There'll be a class, right? And there are the doctor's name, our mentor's name. So Harnish, Bhatia, and then chamber enlargement by ECG will be taken by Dr. Sudhakar Rao, and AB will be taken by Dr. Manish Roy. And so guys, let me tell you, Dr. Harnish Bhatia, I told you about, but now Dr. Sudhakar Rao, he is associate professor at Manipal Academy of Higher Education, and he's recently shifted to Manipal Corporate Hospitals, Bangalore. And then Dr. Manish Rai, if you ask me, he is the electrophysiologist cardiologist at Kasturba Medical College, Mangalore, and Dr. Mukund Prabhu is electrophysiologist at Kasturba Medical College, Manipal, and we have Dr. Harnish Bhatia as well with us, right? So this is the schedule I'll be sharing with you in the group, and now I invite Dr. Harnish Bhatia to discuss about certain things about course, how we are going to conduct the entire course, how we are going to what are we actually going to cover in next 10 sessions, and how you're going to give the exams at the end. So a brief about the course in next 5-10 minutes. Over to you, Dr. Harnish Bhatia. Thank you for joining.
Thank you so much, Dr. Ajit, for that brief introduction and briefing about the course. So with that, good afternoon. I'm Dr. Harnish Bhatia from New Delhi, and welcome to the ECG Master Course. First of all, thank you so much for showing up in such big numbers. It gives us immense pleasure and pride to do our work when the response is so inspiring, to say the least. It's my pleasure to announce that we've been joined by around 800 people who will be directly attending the course through the Zoom meeting, and another 2,500 people who will be watching it on YouTube Live.
Yes.
It's a big number, I know. Despite that, we will try our level best to make sure we reach every one of you and clear all of your doubts throughout the course. I know this COVID pandemic has changed our lives completely, but it also brought some good changes along with it. One of which is telelearning. It enabled us to look for alternate sources of teaching and learning when traditional ways of classroom teaching were hampered. The result is the development of such courses where we can sit in the comfort of our homes and learn any skill. So this class is just to orient you about what to expect from this course in the next 2.5 months or so. So first things first, why do we need to learn ECG, right? So we all know how important ECG is. It is the most basic yet most informative diagnostic test we have. It can be done at the bedside. It's usually the first investigation done whenever a patient presents to the emergency department of any hospital, irrespective of whether the presenting complaint is cardiac or not cardiac, right? And it gives us immense amount of information, not just about the heart, the conduction system, but also about the acid-base status, about the electrolytes, and a host of non-cardiac conditions as well. So there's no doubt about how important ECG is, and we can derive a lot of information from just a strip of ECG. So the next question which arises is, who all should know how to interpret an ECG, right? So first of all, of course, a cardiologist should know. Then physicians of other specialties like medicine, gynec, pediatrics, orthopedics, surgeons, all of them should know how to interpret an ECG, at least the basics of it. Then even general physicians and residents, especially working in the hospital, who are the front runners